Hello, my name is Andrea Aguilera. My topic is about Spur cell anemia. Definition: Spur cell anemia is an acquired hemolytic anemia associated with liver cirrhosis and is characterized by the presence of increased large red blood cells, which are covered with spike-like projections that vary in width, length, and distributions. Spur cell anemia is an independent predictor of mortality in liver cirrhosis and has been associated with extremely poor prognosis.
In the previous video, we have discussed echinocytes or Burr cells. Today we'll talk about acanthocytes or Spur cells, an abnormally shaped red blood cell. Where did the word come from? From an ancient Greek word called acantha, meaning thorn, like these thorns. Cyte means cell. So, acanthocytes or Spur cells, they are red blood cells with spiked membranes, abnormal membranes. They have coarse, variable sized projections at variable distance from each others. Okay? If you remember the previous video, echinocytes, these projections were smaller, more numerous, and they were at equal distance. But here, acanthocytes, variable distance, coarse, and variable size. Okay, when do we see acanthocytes in the blood? Please don't forget A-beta lipoproteinemia, which is a rare autosomal recessive disorder, deficiency in apolipoprotein B48 and B100. There's a problem with chylomicrons and VLDL. Okay, what else? Liver disease, McLeod syndrome, chorea acanthosis, neuroacanthosis. They're very rare diseases, but please, if there's anything that you can learn from here, A-beta lipoproteinemia, they have acanthocytosis. What is the pathogenesis of these cells? Alteration in membrane lipid or membrane protein of the red blood cell. Sometimes in cases of severe liver disease, these acanthocytes will go to the spleen. The spleen will try to make them more round, more circular, and this is called spheroacanthocytosis. Hey, thank you for watching this lecture. Don't forget
Application in medicine. The study of the peripheral blood smear is a fundamental investigation, has an orientation towards the diagnosis of different types of hemolytic anemias. The diagnostic orientation of this complementary is fundamental in microangiopathic hemolytic anemias due to its severity and in the follow-up of this. Pros and cons. Pros. As for treatment, abstinence from alcohol is required to avoid the progression of alcoholic liver cirrhosis. Cons. Liver transplantation remains the only curative treatment for reversing ACA, and very few attempts have been made for treatment without liver transplantation.
If you have anemia, your blood does not carry enough oxygen to the rest of your body. The most common cause of anemia is not having enough iron. Your body needs iron to make hemoglobin. Hemoglobin is an iron-rich protein that gives the red color to blood. It carries oxygen from the lungs to the rest of the body. Anemia has three main causes: blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Conditions that may lead to anemia include heavy periods, pregnancy, ulcers, colon polyps or colon cancer, inherited disorders, a diet that does not have enough iron, folic acid or vitamin B12, blood disorders such as sickle cell anemia and thalassemia, or cancer, aplastic anemia, a condition that can be inherited or acquired, and G6PD deficiency, a metabolic disorder. Anemia can make you feel tired, cold, dizzy, and irritable. You may be short of breath or have a headache. Your doctor will diagnose anemia with a physical exam and blood tests. Treatment depends on the kind of anemia you have.
Issue applied in Ecuador. The cumulative sum of these factors could be the basic reasons for the high frequency of the incidence of anemia in the highlands of Ecuador, Peru, and Bolivia. The frequency of anemia in Ecuadorian children between 6 and 59 months was calculated using the data published by the Nutrition Unit. They had reported a prevalence of 25.7% in Ecuador. Conclusions. In conclusion, blood transfusions and control of fluid retention were successful in managing ACA related to alcoholic liver cirrhosis. This finding, which is dependent on the assumption of abstinence from alcohol, warrants further investigation for the management of ACA without liver transplantation.
Sometimes stuff happens and the red blood cells acquire an abnormal shape with some projections. We call this echinocytes, also known as Spur cells. This is Medicosis Perfectionalis, and let's continue talking about hematology. So let's get some etymology out of the way. Echinocytes. Echino comes from a Greek word called echinos, which means a hedgehog, like this one, with spikes. Cyte means cell. Echinocytes, also known as Spur cells, are red blood cells with abnormal membrane. They have small, thorny projections at equal distance. Very important, at equal distance. They are numerous, they are small. Do not confuse that with acanthocytes or Spur cells. These have large projections, less numerous, and the interval or the distance between them are variable. Here they are uniform, equal, nice. Here are very variable and haphazard. Echinocytes are reversible, so that's good. But what are the causes of echinocyte? So we have artifacts such as EDTA. While preparing the blood, we put it in a test tube, but this blood can coagulate, which is not good, so we put some stuff in it so that it cannot coagulate. This can cause the red blood cell to become like this. Also uremia. This is huge. If you will remember anything from this lecture, remember that uremia has echinocytes in the blood film or the peripheral smear. Also pyruvate kinase deficiency. Yes, we have discussed this before, and it had echinocytes or Spur cells. Hypophosphatemia, hypomagnesemia, hemolytic anemia, and marathon runners. They run for a long distance. They can get echinocytes in their blood at the end of the race. Echinocytes and acanthocytes together, they are called spiculated cells. Please don't forget, uremia, renal failure, has echinocytes in the blood. I hope you have enjoyed this lecture about one of...
Thank you.